The registration of businesses in eThekwini Municipality is underway. The Metro says it's optimistic all businesses will be registered before the deadline, as announced by President Cyril Ramaphosa, that all spaza shops need to be registered within 21 days. The city has 5 centres where spaza shop owners can register their businesses. This after at least 23 deaths countrywide, allegedly linked to food sold at spaza shops. The eThekwini Municipality says there are 55,000 informal trading businesses in the city. Of that, 4,700 are licensed. The municipality says the registration process at their business units across the city has been seamless. Officials say the renewal of a business license is free. For owners renewing their permits, they must provide proof of their business premises, as well as the approval by health officials and the fire department. Hardin Ratshisusu, who's a National Consumer Commission Acting Commissioner, joins us to expand on the conversation. A very good evening to you. Thank you so much for your time. I mean, we've seen so much of the, spaza shop owners trying to meet the deadline of 21 days, ensuring that there is some form of registration and compliance. What is your reaction to that as we take stock of the bigger problem and some of the resolutions that are needed?
Good evening and thank you for the invitation. From the National Consumer Commission, we welcome this move because it's important that businesses that operate in South Africa do so within all applicable laws. I say this because when the National Consumer Commission enforces the Consumer Protection Act, it often encounters situations where businesses, though we are looking at consumer protection, are not complying with many other laws, including applicable bylaws. So this pronouncement by the President is quite important because it will enhance compliance in the country, not just with one law, but with all applicable laws in our country.
What role have you played in this regard? Because, a lot of your work is centered around protecting consumers and ensuring that if products are not fit for consumption, that they're recalled. Just yesterday, SABC News covered a story where KwaZulu-Natal police officials uncovered and discovered warehouses, all with expired foods. I mean, what role would you play there?
We play quite a crucial role because in all of these operations, the National Consumer Commission is part of this because we have to ensure that prescripts of the Consumer Protection Act are adhered to. So when we are part of these multidisciplinary operations, we are looking at our part of the mandate. And we were in KwaZulu-Natal this week in various other areas. And you can see that what the SAPS has uncovered and the ministers have in their speech, in their statement today, announced this, that those 3 warehouses had illicit goods, ranging from food, pesticides, and many other items, estimated to a value of about 800 million rands. What that means is that this is the kinds of harms that you would experience in the economy. It's a drain in the economy. It's a drain in the sense that it takes away business from legitimate businesses, because in most cases, these kinds of goods are sold at very, very, very low prices. And this is what also Minister Tao emphasized in response in this particular briefing.
Unfortunately, lives have been lost in this regard, and we continue to hear more and more of these horror stories. For those who are fortunate enough to have survived, what impact do such products in the market have on their overall health and well-being?
These products are quite harmful in our view to the general population and the well-being of the population. It affects the health of individuals. And that's why the National Disaster Management Center has classified foodborne illnesses as a national disaster. And this was announced today by ministers in the briefing. So what this means now is that it's no longer business as usual. And you are right, we are losing a lot of lives, and lives in the main of very young people, children in our communities. This is not something that we are taking lightly. It's something that from here on, and we've been doing these inspections, we've been pursuing companies, but now there will be intensification, not just from the National Consumer Commission, but also with all other regulatory authorities and enforcement bodies that we are working with.
What kind of intensification are you referring to as the NCC?
What you will see in the next few weeks is quite intensified operations, multidisciplinary operations that will be participating in covering a number of areas. So we've been covering, specific areas. We'll go to Gauteng, cover some areas here and there. But now you are going to see this being massified because we have to ensure that we reach as many communities as possible. And we hope that in that time, a lot of businesses would have registered, would have ensured that they are complying with all applicable laws. So we hope if there is compliance, we will see less of actions we'll have to take. But if the situation continues like this, you are going to see a lot of action being taken from ourselves and other enforcement authorities.
Perhaps expand a little bit on the actionable items and also just touch on the capacity. Are you capacitated enough to reach as many communities as possible? I mean, I asked you this just yesterday in my conversation with Health Minister Dr. Aaron Motsoaledi. He spoke a bit about a team that will be formed, and while it's all well and good to talk about this big team, we know that there is shortages of nurses and doctors in hospitals. Where will the capacity and the time come in to ensure that this matter is dealt with the much needed attention, and that there is some sense of accountability here, because communities are really, really uncomfortable with this and looking to find viable solutions to prevent death?
Indeed, you are right. I think we obviously have, a certain, number of personnel that we have that we can deploy in these operations. We also work not just as the National Consumer Commission, but with other regulatory authorities. So you are going to see a lot of collaboration, so enhanced collaboration amongst regulatory entities. So we are working very closely with the National Regulator for Compulsory Specifications, the South African Bureau of Standards, the National Meteorology Institute of South Africa, and many other regulatory authorities. Why I mention these authorities? Because there is a lot of, for instance, testing that is required in the products that we find non-compliant, because we still need to establish what is the cause of the contamination where we establish this. But by just joining hands at both national, provisional, and local level, looking at a common area, with a common purpose, that on its own increases the capacity available for these organs of state to respond to this. So if we are all going into a particular area with all our resources, you will then be able to see the impact that we can make instead of a situation where we are not in a crisis situation where authorities can then just run operations, as they are planning in the normal course. But you are going to see a lot of coordinated action. And it is through coordinated action that we can make the greatest impact. And I think South Africans will see this as we start carrying out these operations.
Very well. Thank you so much for speaking to us this evening. Wrapping up that conversation with Hardin Ratshisusu, who's the National Consumer Commission Acting Commissioner, joining us, of course, expanding on the discussion and the actions of the NCC.